So hi, I'm Noelle Frey, and we're here in Miami at the first international workshop for CAR T-cell therapy. And here with me today is Dr. Daniel Lee and Dr. Bianca Santomasso, and we just finished our session on CAR T-cell related toxicities. And so I wanted to ask you, you both were very instrumental in the development of consensus grading scales for both CRS and neurologic toxicity. And I wanted you to share with us how you think that's going to impact the field moving forward. I'll start with you.
Yeah, well, thank you, Noelle. It's a great question. You know, up until the ASTCT consensus guidelines were published, different clinical trials, different facilities were using different grading systems to describe cytokine release syndrome. And so it really created a big problem because it was very difficult, in fact impossible, to compare different products to others when such comparisons could reasonably be made. But also it created a whole like almost impossible way to come up with a way to manage or guidelines to manage cytokine release syndrome. So really it was quite instrumental to get 49 investigators and representatives from CIBMTR and ASH and the NCI together and others in industry in the room to come up with these criteria that hopefully now that this is published, that future clinical trials and in fact the community the broader community that's giving commercially approved CAR T-cell therapies can then use so that we can all be talking the same language now.
Well, I think my opinion is that these consensus grading scales for both neurotoxicity and cytokine release syndrome have been in general very well received, in part because those of us in the field were acutely aware of those issues that you just mentioned. And I like the simplicity of the scales, really focusing on the clinical signs and symptoms of these toxicities. And of course, the next natural step forward is to try and develop consensus guidelines. And so, Bianca, do you think that will be quite as straightforward, or do you foresee challenges?
I foresee challenges. I mean, but I think we can. I think there's a lot that we will be able to say. First, I'd just like to say that I think that the guidelines for grading really simplified and defined, I think, the neurologic toxicity, which we now call ICANS for immune effector cell neurotoxicity syndrome. And I like the S, the syndrome part, because it kind of encapsulates that there really are a defined set of symptoms. We know that really mostly what's seen at the bedside is encephalopathy, but that was kind of hard to really grade before. It was very subjective. And so the ASTCT guidelines also outlines a score, a 10-point score called the ICE score, which can be done at the bedside very easily as even a nursing check that kind of defines, it's kind of like a pared down mini mental status score, 10 points, 10 being perfect, and then you lose points for deficiencies in language or attention, in writing, following commands. And I think that both contributes to the scoring of the encephalopathy component and also can be used as a check. And then obviously the other components are level of consciousness, seizure, with any seizure being a grade 3 and repetitive seizures being grade 4 if there's no return to baseline, and then signs or symptoms of cerebral edema, really highlighting just the potential for very severe ICANS, fortunately rare. I think for management, that's going to be more difficult. I think most centers are using, for the ICANS, they're using corticosteroids, and I think it's pretty clear that most centers intervene at grade 3. But I think there's some variation in practice as to the earlier grades. What about grade 2? Maybe you do in some high-risk patients with certain products, but not others. Some people would even say, we should be intervening at grade 1 if you have a very high-risk patient who also has concomitant cytokine release syndrome. So I think that any management guidelines will also incorporate some aspect of just defining the risk factors as well. And I think in our session we talked a lot about the risk factors for CRS.
Yeah. I agree. I think the guidelines for management are going to need to incorporate a lot more individualization, both in terms of the patient you're treating, the disease the patient has, and the product that you're using. And so I think the guidelines, I hope, will be helpful, but also will have kind of more nuances in there. So we talked a lot today in the sessions about potential ways forward for both preventative and interventional strategies to potentially improve outcomes for patients with toxicities. And what are you guys most excited about going forward?
Well, I'd love to see that some of the new agents that have recently been described, whether in anecdotally or in animal models, newly developed animal models, like anakinra, perhaps anti-GM-CSF targeting. But there's still room for other agents, even that targeting IL-6, like siltuximab. These haven't been formally studied yet, and I think we really need to move in that direction. Tocilizumab is fantastic, and I don't think any of us would be here talking about CAR T-cell therapy today if that seminal discovery had not been made many years ago. But there's many other avenues to make CAR T-cell therapy safer. Drugs are one component of that, but really the next wave of the future is re-engineering CAR cells to mitigate some of these toxicities, either perhaps automatically or spontaneously, or making them controllable.
I think the other point is that we've seen very promising responses with tocilizumab as far as cytokine release syndrome, but it's also clear, I think we heard a lot of data today showing that it doesn't help neurologic toxicity. So I think especially for the neurotox, you're kind of stuck with corticosteroids, so I think there's a real question, is there some other cytokine-directed therapy, whether it be direct IL-6 blockade or IL-1 blockade or GM-CSF, or even other approaches maybe to support vascular endothelium that could be helpful. So again, I think those are probably questions best answered through clinical trials. And I think some of those are going to be, we should hear data coming out in the next couple of years, hopefully. So we'll see.
Yeah, I think it's an exciting time. I think the pace at which we've moved forward in this field in general is pretty tremendous. And so we're hopeful at the meeting next year, International Working Group for CAR T-cell therapy in 2020, that we'll have some answers to some of these questions. Thanks.